Hey guys, Jason Robinson, and I want to welcome you to the Healthcare Reboot. This is the official platform for the Academy of Prevention and Health Promotion Therapies. Myself and my co-host Dion Jewell are using this as a way to have a variety of conversations with health-facing physical therapists and other healthcare pros who are living a lifestyle and a practice very much centered around health, wellness, prevention, and health promotion. There are a lot of very talented therapists and healthcare pros who are out there carving this niche and leading the way for us. And we want to get their voices heard, and we want to connect them to the masses so that this can become the norm in the healthcare community. This platform is going to be viewed on YouTube via our YouTube channel. However, the audio portion is going to be recorded and available on podcast through Dustin Jones' Senior Rehab Project. So we're very happy and excited to have Dustin collaborating with us on this as well. So whether you want to watch the videos on our YouTube channel or whether it's more easy for you to interface with us via the podcast, you're able to do so. Either way, we want you guys involved. This is going to be a bit of a regularly scheduled program. We hope that on a once-a-month basis, we can interface and chat with one of these therapists that are out there leading the charge. However, we expect to have some capacity to do some more Facebook Live type moments too. If we witness something playing out that very much connects to our message, we want to have an opportunity to put that out there and interact with everyone and have that be a moment of good communication and good interaction. So stay tuned, whether it be regularly scheduled program as part of this healthcare reboot or something more impromptu. Either way, you're going to see something coming with some regularity here very, very quickly. About a month ago, Dion and I interviewed our first guest, and his name is Rich Gaudio. He has a practice in Virginia called Age Well. Rich is a physical therapist who specializes in the senior population, and it was very fitting then that we had a conversation with him about senior health and wellness, particularly connected to the winter months. So we had a great conversation. It was very long, actually. It was about 50 minutes long, so we decided to break it down into two parts. The first part, which you'll see today, is him discussing with us the different incidences and occurrence rates of particular types of injuries that are often seen in the senior population during winter months. And we talk about these and approaches to help minimize these likelihoods. And in part two, it's a bit of a continuation of that conversation, but we're able to get more so into discussing Rich's new practice, as well as his role with the healthy aging team within the academy. And it's very interesting to hear what those guys are doing in terms of establishing standards of practice and standard of care and how they envision that playing forward here in the coming months. So certainly a good follow-up to part one. So without any further ado, I'm going to turn this over to Dion, who the day we had our conversation with Rich did a great job of introducing him in his practice. So I'm going to turn it over to Dion, let her have it. Here it is, Healthcare Reboot, episode number 1 with Rich Gaudio. Enjoy it.
Thanks, Jason. Yeah, we're really excited to have Rich here on our Healthcare Reboot conversation. Rich and I got to know each other several months ago. He actually reached out to me via a mutual friend because he had some ideas about elder fitness that he was trying to implement and how to manage information around that. At that time, Rich was working in a hospital-based practice, but really developing this novel idea on his own time in his outside hours. Fast forward several months later, and now he has a great opportunity. He's partnered up with another colleague in the Fredericksburg, Virginia area to open a practice, and I think we'll have a great chance there to really boost what he has in mind about elder fitness. So Rich, welcome. We're glad to have you.
Thank you. I'm glad to be here, and thank you for the wonderful introduction. Thank you, Jason, and thank you, Dion. And yeah, I started Age Well is the reference that Dion was making to the service that I started providing in 2016. And the thought process really was, as physical therapists, we need to start looking beyond reacting to impairments and injuries and start focusing on how do we start to prevent some of the ailments and difficulties that seniors run into. And so through a lot of research and time, Age Well was born. And that service really started off providing fitness assessments to individuals, setting up fitness plans. As the year went on, Dion mentioned I ran into Travis Stoner, who's the owner of Fusion Physical Therapy at the Spotsylvania location where we practice now. And we decided that I would be the clinical operator of that clinic. And just this week, we're actually launching, finally starting to take patients and provide the service, which will have a traditional rehab platform, outpatient physical therapy, as well as a wellness component. So I'm very excited about what AgeWell has become. And the development of the Academy of Prevention and Health Promotions has also created an opportunity for me to take AgeWell to more of a corporate platform than just providing services to the individual. So I'm very excited about all these opportunities that are taking place at this time.
Well, thanks for that description. It is exciting. As Jason mentioned, one of our interests, just given the season, it's February now, has to do with winter health. And I don't know about you guys, but I notice every year, usually starting in November or December, you start to see interest pieces in the newspapers and, brief segments on cable news channels, et cetera, about winter health, with a particular focus on the elderly. And given that that's an area that you're focused on, particularly with fitness, we thought it'd be a great opportunity for you to maybe share your perspective on what you see elders doing in the wintertime that might threaten their health and things they might do to avoid those problems.
Absolutely. Yeah, my very first encounter with that was years ago, back in 2000. I was working at a nursing home, and between Thanksgiving and Christmas, so that 30-day span, we had experienced a death every day in the facility we were in. So 30 days, 30 people had passed, and that was the first time I had noticed, as a professional, it was a couple of years into my practice, and realized that winter does indeed have this effect on human beings. And through some of the research, it's so interesting. Just like we see in the news and the headlines, tends to be the more dramatic things always catch everyone's attention. So, just in general, you talk about deaths by diseases or plagues or natural disasters. Those tend to be very dramatic and catch people's attention. But really, the vast majority of people in the world die because of chronic conditions. Well, it turns out that it's a similar story when it comes to cold weather. It turns out that cold weather is significantly more deadly in most parts of the world than warmer weather conditions, but it really isn't the big dramatic things, the things we typically think about. We hear all the news bites on, the heart attacks during shoveling, the falls, the hypothermia, freezing to death. Those sorts of things are not really the big killers. It turns out that it's a little more insidious and a little more sinister than that. Cold is a killer. It turns out some of the research tells us that in the United States particularly, a winter day is 10 to 15% more deadly than a summer day, just because of the weather conditions. But it turns out that it's not extreme cold. Extreme cold has a very small percentage that it plays in that process. It really is just temperatures cooler than the average or the optimum day in the particular time of year. And more specifically, when you look at the data a little more closely, it tells us that it's actually in areas where it tends to be warmer and it's unexpectedly cooler that you tend to see the death rate rise dramatically. And there really are, I've kind of coined it this way, there are three major things that go on there. And one is the killers themselves. And when you start investigating this like a police investigation, you realize that the primary two killers are clots and bugs. And the clots themselves, this is really something that tends to happen. Most likely, you'll hear about it in the form of a heart attack or a stroke. That's typically what we hear about. The death rates are related to those two issues. But the bigger question becomes, why do the clots increase during this time of year? And really, with that cooler temperature, not the extreme cold, but just the cooler temperatures in general, especially in places where the homes don't insulate quite so well against the cold, or in places where people are not equipped. They don't have the proper attire or clothing to wear. We find that as the temperature cools, the body responds to the environment. It begins to decrease peripheral blood flow. It decreases the blood flow to our skin and keeps the blood more condensed in the center of our bodies towards the core. And that immediately increases volumes. And the consequence of that is that salt and water get pushed off into our tissue. And so that actually thickens our blood. So there's less blood flowing around. It's more concentrated to the core, and it's a thicker consistency. And those two conditions are kind of create a recipe for clots. That increases the likelihood of someone throwing a clot. In addition to that, also we find that blood pressure tends to be higher when the weather's colder. And so you've got really a deadly combination in high blood pressure and thickened blood. Beyond the clot, then you have the bugs, and this is probably a little more common for most of us in the sense of colds, flus, and pneumonias. And we tend to spend more time in close quarters, in proximity with one another during the colder weather. And so we tend to find ourselves getting exposed to those sorts of things. The usual suspects, the ones I mentioned earlier, the traumas, the slips and the...
I didn't mean to interrupt you, buddy. I was thinking back in your introduction, you were talking about fitness assessments, fitness tests. I'm wondering how these particular issues might alter how you go about some of the assessment tests or fitness tests, or even the overall fitness plan as you get into the winter months. I'm sure that's probably something you're going to get into in a second, but that just popped into my head as you were talking through some of these differences.
No, it's a great question, and yeah, when I looked at all this research and what are the things we can suggest, one of the first things that came to me was really age well, and I think for most people, and this is a great opportunity for us as physical therapists, because the interventions here really to help manage this are very similar to the way we manage chronic disease in general, and really the number one principle or tip is just aging well. The idea of staying hydrated and staying well nourished. And these are no small feats for a lot of our seniors who live on their own and don't have a lot of resources. But and it sounds very fundamental to people who are in the fitness realm, but the idea of keeping yourself hydrated. When it's cold, people tend to automatically drink less. So, and even seniors do not necessarily think about making a warm cup of tea or something like that that can help get them the hydration that they need. So that's a really critical part of it. Making sure that their food is nourishing. A lot of the seniors I interact with tend to tell me that they just, in these winter months where it's darker and colder, longer, they just find themselves less active and less hungry. So they tend to avoid eating because there's no stimulus for that in their world. And probably do a whole podcast on the idea of staying active, just sitting less and moving more, and how critical that is for our seniors during these winter months. So, and then maybe just a couple of things that are less intuitive, washing hands and keeping optimum hygiene, especially if you're in a space where there are a lot of other people, especially if you're in an environment where you're around your kids or grandkids. Being able to keep your hands clean is, just like in most healthcare settings, critical to reducing the spread of infections and diseases. And then sometimes people tend to have very strong opinions about whether they get their flu shots or not, or whether they get the pneumonia vaccines, but these things are showing to have a big impact on prevention and avoiding. So I don't know that I particularly would modify my fitness assessments, because that's kind of an elective thing. Someone decides to come into my space and be assessed. But for sure, there are some easy self-care tips that if you're practicing this sort of thing year round, it certainly gives you an advantage heading into the winter months. And then if we want to go into it, we can talk about some of the other tips.
Well, so Rich, one thing I know for myself, my father-in-law is staring down age 90 later this year. And one thing that's true about him, although I would say this is year-round, not just the winter months, is that he loves to keep the thermostat on his heat pump set at 80 degrees. And that thing runs non-stop. And it's not, you know, a humidified system. So not only are you hot in that room, but it is awfully dry. And I would think that temperature control, assuming an elder has control over it, also can be a real challenge that elders in particular seem to face, because I remember my grandmother being the same way. Everything had to be set at tropical. So do you talk to us about how physical therapists might coach their elder patients, whatever the reason is that they're seeing them, on that topic?
Yeah, that's an excellent point. And yeah, we do find this consistently. I've been in plenty of assisted living facilities, and the warmest places in the building are each apartment where it's 80 something plus degrees. And yeah, generally the advice sounds counterintuitive, because the easier step is certainly just to keep the space warmer. That the literature talks about it is somewhere between keeping the thermostat between 68 and 76 during the daytime, actually. So you keep the space warm, but not tropical. And I think that's a good way to capture that in having that discussion. Now, a lot of the seniors, their ability to sense the temperature in the room is somewhat impaired or limited in some way, or maybe dulled down compared to what it used to be. So their perception is that it is not necessarily tropical. It just feels warm to them. But really the old wisdom of layering up just actually makes a lot more sense. So you keep the room at a more temperate level, and then you layer yourself. And you'll find this even in the middle of the summer when you go into these assisted living, and even in some independent living communities. A lot of the seniors are in shirts and pants and sweatshirts and sweaters in the middle of summer. And really, that's probably in terms of how their physiology works and the ability of their bodies to cool themselves. It's probably a better way to go. If they're feeling warm, they can shed a layer. If they're feeling cooler, they can add a layer. And that's probably more physiologically friendly, allows their bodies to adapt to the environment much better than actually toggling the environment to a more extreme temperature.
So, Rich, when you mentioned that the literature pretty much supports that geographically there may be areas that are more likely to be warmer than colder, so that when they get hit with cold snaps, that might be when some of these extreme issues become more relevant to folks in that area. I'm from the Chicagoland area, so wintertime is exceptionally cold. Usually, most folks who have lived here their whole lives are generally prepared in the winter. But we have legislation in Chicago that mandates that landlords keep temperatures between 68 and 72 degrees. So I know that at least in the northern climates, there's probably civic action that helps to prevent seniors in situations like this. Did the research or any of the literature that you were coming across support maybe where a demarcation line may be? Like, is there a certain area that tends to be more of a geographical hot zone when it comes to some of these climate issues? And if so, are you aware, are there other civic or policy things going on that might help to prevent against some of these extremes when they come up?
In the information I looked at, basically one of the major areas that they outlined was on the East Coast. North Carolina is kind of a great scenario, which is just the state south to where I live in Virginia. But it's really along that line where you're just kind of entering the south, just kind of exiting the north, along those latitudes. I did not see any specific demarcation of latitude or longitude that would give us a specific on that. And I'm not quite familiar with any civic action, but that's certainly from a therapist standpoint of physical therapy in the promotion and health prevention and health promotion setting. It certainly gives us some opportunities if you're looking at what can you do on a greater platform or using a bigger lever, if you will, to change things in your community. This is certainly an area where legislation would be helpful. And I imagine we could take a lesson from our northern states. It's interesting, in those northern states where the cold tends to be more of the routine, we find less of that. So some of these action steps are probably a good step to take. But even in general, for physical therapists, I think knowing the resources in your community is a huge step. If you're not at that community level where you're doing this kind of work on a legislative platform, even just having the resources at your fingertips is a great start. So everything from the common sense of being a good neighbor. If you live in a community where you've got seniors that live on their own, or a couple, checking in on them, making sure that they've got enough food, enough water, that they've got access to their medical appointments, that they've got someone that can clean off their sidewalks and such, I think is critical. Knowing the places that are acceptable to go and be active during the day. And in some of these spaces where maybe the legislation isn't in place, a lot of these seniors will just kind of sit in a cold house most of the day. And the reality is they could get up and go out, maybe with a friend or a couple of friends, and do some walking around the mall or in a bigger box store, and spend some of the day in a warmer space, and actually being more active and socially engaging, which all helps push back against some of those other variables we spoke about earlier. Local churches, knowing your churches and agencies that are out there that are willing to provide either ministries or volunteer services that can do everything from provide firewood to transport to medical appointments, speaking with the utilities. And some of these agencies collaborate with utilities, and they have programs for helping with if you need funding for either gas or propane in order to keep your house warm. And then knowing the municipalities, what resources when the cold hits. Around here in Fredericksburg, there's a massive combination of effort between the city of Fredericksburg, the surrounding counties, and churches. They'll do everything from going out and providing sleeping bags for the homeless to actually collecting people and bringing them to shelters. So as physical therapists, again, putting your prevention and promotion hat on, knowing those resources, what already exists in your community is I think, a weapon that we haven't really, or a tool that we really haven't had in our toolbox in the traditional rehab model. So having those resources available to you then opens up that platform. Find out, hey, there's an opportunity for legislation here that I didn't even know about.
Well, I hope you enjoyed part 1 with Rich. Part 2 will be airing shortly. In the meantime, stay connected with us on Twitter at the APHPT or at the website, aphpt.org. Thanks. See you soon.